I'm so glad to see such a large turnout this morning to hear from our speakers. Senator Cindy Friedman, who's with us right now. Cold weather doesn't deter you, I guess. Welcome to the sixth in the 2025-2026 First Friday series, sponsored by the League of Women Voters of Lexington. It is Friday, February 6, 2026 at 9:30, and we are in the Lexington Community Center. I am Margaret Copey, convener of the Lexington League. With us today is Senator Cindy Friedman. She was elected to the 4th Middlesex District in 2017, which includes Arlington, Billerica, Burlington, Lexington, Precincts 1 and 2 and 4 to 7, and Woburn. Prior to becoming a state senator, Friedman worked as a public school teacher and senior manager in high tech. In addition, she served as chief of staff for late state Senator Ken Donnelly. She will be speaking about the work of the state legislature with special focus on how the state legislature is dealing with current challenges brought about by federal changes to abortion regulation, reduction in research funding, and vaccination requirements. LexMedia is recording this meeting for future broadcast. There will be time for question and answers after the program. So with that,
No, that's okay. Hi, everybody. My druthers are that I speak for a very short amount of time, and then I take your questions, because what I'm really interested in is what you want to know about.
Sure.
So, just to level set, I guess. So I have two sort of major positions in the Senate. I'm the Senate Chair of the Joint Committee on Healthcare Financing, and we get all the healthcare, that was good. We get all the healthcare bills that are filed in the Senate. And the other one is that I am the Senate Chair, I'm the Chair of the Senate Committee for Security and Policy. And this committee has always existed, but in this session, my job has been to lead the Response 2025. And the Response 2025 is a initiative that the Senate President set up to focus on what was happening at the federal level that was affecting Massachusetts. And the Response 2025 was named that in response to Project 2025. And so our job has been to track all of the bills that have been filed, look at policy issues that are coming up, and find those that we believe will have the most impact on the state in terms of protecting our residents, defending our values, and leading Massachusetts through this, what many of us think is a very dark time. So those are basically the two things that I focused on. I'm wondering, would you mind if I sat down? I am getting over a round of antibiotics, and I realize that sometimes, yes, that's perfect, thank you, okay. So what we focus on is the things that we're trying to figure out, what can Massachusetts do in this time? And it turns out there's lots and lots of things we can't do because of the United States Constitution, but there are things that we can do that we think can protect people here in Massachusetts. And a couple of those things I'll just talk about. One is the SHIELD Act 2.0. And last session, Taylor, will you just turn it off? Sorry. Sorry about that. This is to protect anybody, and we mean anybody, any provider, any public employee, any friend, any person who is helping people get legally protected health care in Massachusetts. So it's specifically for, it specifically came out because of the attacks on women's choice and on transgender care. And what we saw was that there were other states that were filing criminal laws that criminalized helping with abortion, helping with transgender care. And so we in Massachusetts implemented a whole bunch of laws protecting, indemnifying, protecting anybody who was in the business of helping those people get that care. And so we did the first version last session, and we did the next version this session, because you implement something and then you see where all the holes are or where the thing didn't quite work that way. So we've increased that. So that's one thing that we did. The other big piece that we did is data privacy. So the Senate has passed a pretty comprehensive data privacy bill that the biggest thing that it does is it doesn't allow your data to be sold or given to someone or some entity without your permission. So what's happening, as you know, is you walk down the street and your phone is on, and that data gets grabbed. And then the most insidious thing that happens is what's grabbing that, the app or whatever, now has that data, and people buy that data. And one of the things that we were seeing is that in the women's health space, these anti-abortion quote clinics were grabbing that data, right? And if you were somebody that came in, or you were somebody that was close to an area of a Planned Parenthood, they could grab that data they could buy that data from the tracking system. And then that data could be sold, that data could be given to anybody. And what we said in this bill is, no, you can't do that. That data is your private data, and you can't sell it or you can't give it away without your permission. Now, that's a really heavy lift, and we understand that. And none of us live in a world we don't know that the US government is capturing all that data as well. But at least it put a stake in the ground, and it gave people the opportunity to A, fight it, and B, to have a private right of action that allows you to make it criminal for entities to do that. So that's the kind of thing that, and there are lots of other bills, and if you go online to the Mass Legislature website, you'll see committees, and if you look under, click that, it'll say steering and policy. You click on that and you can see all of the things that we've looked at over the past, since this session started. So that's that's steering and policy. And then the healthcare financing, of course, we are in a situation now where the federal government has decided that we shouldn't be giving healthcare to low income, middle income, and poor people. And that was what came out of the OBB, which I call the one big bad bill, OBB 3, is where they cut Medicaid, they have cut access to Medicaid, and they've taken away, just to name a few things, and they've taken away tax credits from people. And what we expect in the Commonwealth is that about 300,000 people will lose their health care. And what this means is that we have certain programs in place. One of the big one called the Health Safety Net. The Health Safety Net is to pay hospitals and community health centers money for uncompensated care. So people who don't have insurance, people who are underinsured. We have a fund that pays for that uncompensated care. That is now $600 million there's a gap, $600 million. And so what's going to happen is that as more people lose their insurance, they're going to end up in emergency rooms, or they're going to go to a community health center where a community health center must provide the care, where the hospital must provide the care, and we're now going to be on the hook for funding that care. And so we have to figure out how do we address that? We can't fill that gap as a state. We just don't have that money. And so this is something that we are working really hard to figure out and try and understand and see how we can help people. Because we don't want people to go to the emergency room for their care. And we don't want people to have to get that sick that they have to go to the emergency room. And a number of these people are immigrants, right? Because we would pay for children, we would pay for people who were here on temporary status or were legally in this country. They had access to health insurance, and now they don't, because the federal government says no, you can't. We're not going to pay for immigrants. So that, along with a lot of the whole healthcare system right now going through a crisis in terms of the costs. I know there's people here, I mean, you probably all have somehow, or your families or somebody has been affected by the costs of healthcare, right? Or the access to healthcare. And so the Healthcare Financing Committee has been spending a lot of time on figuring out how do we fix primary care? How do we get the system back to focus on patients rather than profit? And what is it that we as a state can do in these particular times? So those are the big pieces of, one more, because I know you all care about this, is immigration. So steering of policy has kind of moved, our focus right now is on immigration. And this has been, I have to tell you, one of the hardest problems I've ever worked on, because immigration fundamentally is a federal, it's under the purview of the federal government. And there's very little that states can do in the immigration space because we are not in control of it, and the Supremacy Clause says, it ain't yours, you can't touch it, we the federal government do immigration. So how do we respond to what is happening in our, across the country? And I think we're starting to understand some of the things that we can do. We have been watching other states very closely to see what they're doing legislatively. And we're also, and one of the things that we're watching is them for states to enact laws and then go to court and then have them struck down, okay? Masking is a perfect example, right? California, I think, tried to ban masks. The court said you can't do that because it's not under your purview to decide what immigration enforcement, it's not yours to decide what immigration agents can do. You don't have control over them, it's a federal government. So that kind of thing has been really, really tricky. And the couple of the questions are, one is, do you want to be performative? So do you, even though you know something is going to be struck down or isn't quite kosher, do you want to do it anyway? Because then it's, you stand up and you makes people feel like, well, okay, but I know it might not work, but I don't care. Or, and the other one is, well, do you want to put a target on your back? I hear that a lot, and I hear it a lot from my colleagues, right? Should we put a target on our back? Should we, or should we just sort of try and stay under the radar? Well, what I'm telling you this is why it's so hard to get something done that is meaningful. So it's so frustrating that we can't just get out there and just do something, right? We can't just say, here it is, let's pass this law, let's do it. It's incredibly frustrating, but it's also, how do you do this in a way that's meaningful? So those are kind of the big issues that I'm focused on right now. We also have 11 ballot initiatives that are coming up, and I must have done something horrible in a past life because I'm now chairing that committee on the Senate to look at the ballot initiatives. And there's some really serious stuff in there, like stuff that would really do great damage to this Commonwealth. The biggest one is the sales tax, right? And the reduction of not sales tax, income tax, sorry, the reduction of income tax. I mean, that would be billions and billions of dollars that would go out of the coffers of the state government. And if you look at, one thing that's really good to do is when you see a ballot initiative, go find out who's funding it. In fact, one of the bills that the Senate just passed, which it was a transparency bill for ballot initiatives that requires a more reporting on who's funding, right? And also, when you are gathering signatures, you're now under this bill, you're required on that form to say whether you are a paid person that's gathering the signatures or whether you're a volunteer. Because I really doubt that the founding fathers thought it was a good idea to pay people to buy elections. And that's kind of what you're doing when you have enough money that I can go out and hire a whole bunch of people to get signatures. This was supposed to be a grassroots, ground-up way of residents in the Commonwealth to have their voices heard, right? And it's been co-opted by, like everything else, a lot of money. So that's a really important thing for you to do because, like, if you look at the income tax, it's all being backed by the High Tech Council, right? These aren't people who can't afford to pay taxes, right? And so what is the game? What is it that they want? And often there'll be ballot initiatives so that the legislature will negotiate. So, okay, we're putting this ballot initiative up. If you give us X and Y, we'll take it down, right? And that's kind of the way, that's often what happens in ballot initiatives and why people fund them or put them forward. So those are generally things that are going on. Those are the big items, and that's just along with everything else that has to happen. Not least of which is all the local concerns that people have and the needs of our municipalities to get work done that they need the legislature to support. So we have. I know it. People always say, "Well, can you say something positive?" I'm like, "Oh, that's really hard." But I will say that we have an incredible Senate president, and that the Senate is really committed to doing work. We work hard. We have sent over probably at this point 75 bills to the House, and that's, as you know, what happens in the first year of a session, we have to hear all the bills that have been filed. And I think there's now over 8,000 bills that have been filed. So we have to hear all those in a hearing, public hearing. So that's what happens usually in the first year and why it's hard to, why you don't see a lot of bills come out, because it's just, you have to do the work of hearing it, and then it has to go through the process figuring out, are these bills good, are they not good, are they constitutional, do they need to be fixed? And then, as you move a bill along through the process, it gets worked on and worked on and worked on, and then it's finally ready for prime time. So, but having said that, the Senate has done quite a few bills that we have sent over to the House, and along with the budgets and supplemental budgets, which come out after a budget. Supplemental budgets come out if there's a shortfall or if there's something that needs to be fixed in the middle of the year that's budget related. So I think that's a good introduction, and I would love to hear from you.
Here.
Wait.
Hold on.
Here it comes.
No. Okay, we have two people here. I have the microphone. You have to use the microphone.
Okay. Hi, I'm a retired teacher and I don't get Medicare because I didn't pay in. Now, this info comes from the MTA. I don't know how accurate it is, but according to the MTA, the governor wants to lower taxes, so she needs to pull in additional revenue. One of the ways she's going to do this is through the GIC, which monitors health insurance for teachers, retired teachers, policemen, firemen. And I'm not sure if she can do this like Donald Trump through executive order, or if it needs to go through the legislature. So if it does go through the legislature, I would implore you to please look carefully at this bill. And I don't think the additional revenue should come from teachers, policemen, and firemen. She should find it someplace else, because the last time this happened, my co-payments went from $40 to $75, just to walk in the office. So please, follow this
Sure.
carefully. Thank you.
So I just want to say a couple things. Number one,
I just want to throw one thing out. You mentioned that you're not eligible for Medicare as a retired teacher.
Right.
But I am.
I know, me too.
I
So-
don't have enough quarters. You have to have enough quarters.
No.
No.
You have to have.
No, if you went, no, I'm just saying, there's something that's different about your situation, because when you said that, I said, I get
Yeah.
Medicare and I'm a retired teacher. But if you went into teaching before 1968,
Oh, I did.
that's what it is. Those people do not get Medicare. You're right.
Yeah.
Yeah. Okay, Cindy.
So I'm going to say two things before you start. Understand that everybody in the legislature is on the GIC, okay? So the MTA's ability, and also the governor is not looking for revenue and taking it out of the GIC. The GIC has a deficit of, I think, somewhere around $300 million. Because like every other insurance, the costs have gone out off the roof, right? They're just through the roof. And so they're struggling with how to fund what they have, right? And so what they have to do, like pretty much any other insurer, because we are self-insured and they have to do this, is they have to figure out how to close that gap, right? Because there's no reserve. Unlike other insurers, they don't have a reserve to go to. The reserve is the state, and the state is now losing a lot of money because of the tax changes by the federal government. So I just want to, it doesn't make your position any better. I have exactly the same concern, but it's happening everywhere. So we have to figure out how do we bring those costs down. Now, one of the things that has really pushed the costs through the roofs is the GLP-1 drugs, right? And I fundamentally believe in GLP-1 drugs, and I fundamentally believe that we should be using them for certain levels of weight loss. But their costs are so high that if, what their choice is okay, well, we won't pay for these anymore because we can't afford it until the price comes down. And then many people say, well, you can't do that because I depend on them, which they may, and there's no judgment here. So then they say, okay, well, we won't do that, but then we have to raise, how do we fix this? We got to raise copays and deductibles. So they're in a very difficult situation. Now, do we want them to do that? Will we look at this? Absolutely. And what's really good about this is, whether this is part of human nature, we're all in this boat together. So we don't want our copays to go up and deductibles. So, but just, I beg of you all to check your research, check what people are telling you, because that is not right what the MTA told you, and it's not fair, right? Because it just it takes people away from helping to solve the problem, and it just helps you go, oh, you're wrong, and you're trying to do this to us. Well, no, we're all grappling with this mess that is coming from the government. So, I hear what you're saying, everyone's gonna look at it, and we haven't seen it yet, so we don't quite know what she's gonna, but it just comes from, we gotta raise, now, I think we should raise revenue. I think I am somebody who believes that I was never in favor of the tax cuts that happened last session. I think we need to raise revenue. You're not gonna see it in an election year. You're just not gonna see it because it's too much of a political,
So, Cindy, can I just quickly, does everybody know what the GIC is?
oh, GSC is the Group Insurance Commission. It's the state insurer. It provides insurance for all state employees and local public employees, and then police and fire and teachers who have decided to buy into it.
Question over here?
Sure.
Identify yourself.
Last week I was watching an interview with the new
Closer to your
governor
mouth,
of
closer
New
to your mouth.
Jersey.
With the new
governor of New Jersey.
Uh-huh.
And she spoke about the gap between the amount of money that New Jersey, basically through taxes, I assume, sends to the federal government and what
They
New
get back,
Jersey is getting back from the federal government.
Yeah.
And I was wondering it's in the order of $72 billion. That's the gap. And I was wondering what Massachusetts' gap is.
Oh, I'm not sure. It's huge. It's probably, I think it might even be a little more than
I
Massachusetts.
meant to follow up with something. And she spoke about how New Jersey has gone to court to try to claw back some of that money. And it's something about a specific program, but unfortunately I can't remember it. But they are trying
Yeah.
in some way to find a mechanism to retrieve some of the money.
Yeah, there's also been discussions about holding back federal dollars, like not paying federal income tax. That actually turns out to has to be an individual decision because the state does not gather federal taxes. They don't grab those. You go directly to the Fed. So, but there's been a lot of conversation about should we be paying this federal money. Now, I'm not sure about that. So we have an incredible attorney general. The last time we looked, she was up to, I think, 49, being part of 49 lawsuits, and 22 of them were where she's the lead. She's the lead attorney general. We should look to see if that's one of the things that they're looking at. I'm not sure, but that's been a hotbed of discussion. Yeah.
We have a question here.
As an aside, I think I saw that the Northeast states are 7 of the top 10 donors to the federal government, and it's mostly the red states that are the receivers.
Oh, yeah, absolutely.
But my question is, outside of the income tax, are there any other questions that are coming up that we should be particularly wary of?
Yes, there's one, and I don't know what the name of it, but it has to do with something called, I think it's 62F. So, okay, I'm trying to explain this. So I believe that there's a law in Massachusetts that says if the state raises a certain amount of revenue and it exceeds that, then it has to go back to the taxpayers as a credit. And I think it happened once.
A
couple of years ago, right?
We all got checks.
There is a ballot initiative to lower that, to lower the threshold, the roof, okay, to reduce how much the state would be in excess. And the way it's determined, the way excess is determined is by a formula, like how many taxpayers, how many, I can't remember the formula, but they want to lower that, and so more money would go back to taxpayers, and what it says is it will not go back in the form of a credit, it'll go back in the form of actual money. So you'll get a check, basically. So this is just another way of bringing down what the state can, what the state can gather in revenue, and then getting it back directly to the taxpayer. So that one is also, would be hugely problematic. Does that make sense?
Yes.
Okay.
I'm very concerned that ICE is going to ramp up its activities here the way it is done in Minneapolis. And I'm wondering if the state has any control at all over what potentially could happen.
No, the state has like control over if the president wants to send in National Guard or wants to ask Texas National Guard to come be part of that, the state can say, no, you can't. Texas National Guard is not allowed here, right? But if they're all federal agents, there's nothing that we can do. They get to come in. I mean, people have to stand up. I mean, look at Minneapolis, right? I mean, that is our power, right? That is, I mean, when you have a federal government that is basically out to destroy the Constitution, and when you have a Congress that's going along with that, the only power that we have is the Constitution and the power of the people to respond. Now, is it easy? Is it going to be like, this is not your, this is not a love fest that we're all talking about here. This is really, really serious stuff. And look at what's happening in Minneapolis. I mean, if you want to talk about heroes, those people that come out in -2-degree weather every day, that is so far, it seems to be the only thing that's working, right? And people get hurt. And so we're never gonna stop trying to fix this problem at the legislative level. And there are a couple things that we think we can do, but it's not gonna stop what's happening in the moment. We can't, there's like, of all the things we're looking at, like creating safe spaces, like we're putting language together, like you can't come into a quote, safe space, and I'll talk about what those are in a minute, without a judicial warrant for a civil, for some kind of civil action, right? And immigration is civil. Okay, well, we can do that. But when 25 huge men in mass come into a hospital and they get beyond the public space, because you can't do anything, you can't control them in a public space, and they don't have a warrant, what's the doctor and the nurses and the orderlies and the PAs, gonna do? I mean, at least it gives us a right, at least it gives us a right to sue. Gives us a right to hold them accountable. But that's a long process. And so what do? We have to be prepared, I believe, to stand up for what we actually believe in, and it's not going to be easy. And unless we can control what happens in other parts of the country so that we get these senators and these reps to put their hands up and say, wait a minute, because all of it is in their power to stop, right? But they're not taking that power, so what do? So there's not a whole lot the state can do, but there are things that people can do. And one of the things that part of what we have to do is we've got to start looking around, and God hopes we make it this long, that we start helping people in other states who are working to change who their reps are. We have to help them in a way that helps them find out what do they need to move different people into those positions. But that's a long term, that's months we're talking about. It's not days.
On my here, but I don't have a mic.
Yeah, you need to use the mic.
Oh, right, because they're filming.
Well, that leads right into the question I had, which, poor you. I can see this is horrible. It's horrible to be in a position right now. Two things. One, ICE is already here, as we all know. I was on a call to Roxbury yesterday, and one of the people in it had actually witnessed someone being taken in Rosendale out of a car that was stopped at a red light. They snatched the person out of the car, left the running vehicle with the door open at the red light, and someone else had to move it. And that's the kind of thing we don't see so much of in Lexington, but it's happening everywhere else. And eventually, I'm thinking about your colleagues who said they don't want to have a target on their backs. Massachusetts has always been a target, and now more than ever. So there's no harm taking action, really. We're going to get it anyhow, eventually, I should think. I hope not. And I was wondering what your relationship as a state legislator is to our representatives in Congress, because frankly, I don't know about other people, and it's easy for me to say sitting here, but I have not been particularly impressed with the stance they've been taking. I know that talking to other colleagues, other friends, they will list all of our president's atrocities, which are numerous, but all of us know that. But what I haven't seen is they're actually taking action in Congress to do exactly what you described, lessening federal power and trying to persuade people. Maybe they are, but we don't hear about it. We just hear the attacks on Trump. So I wonder what you thought about all that, and is there something I can yield the mic to? Thank you very much.
So I think part of the problem, the problem is that they're in the minority. So what they can do, the power they have is limited. Now, things seem to be changing a little bit. I say that quietly because I don't want to put a pox on it. But they only have a certain amount of power, right? Because they get voted. They lose their votes. It's going to be really interesting, I think, to see what happens in the next week and a half or week now with the ICE money. And I think we all want them to do is stand firm. Now, that means that maybe the government will close and maybe people will lose their jobs, and the Republicans will be good at saying it was the Democrats' fault. And that's the kind of price that we pay, right, if we want to actually make a change, right? You have to be willing to take the consequences of your actions, and that means everything that we do. And it's not easy, but to your other point, we have thousands of years of history that tells us over and over again that if you can't stay low when somebody's bullying. It doesn't work. It's never worked. It's not gonna work. And what we know is that the more people that stand up to the bully, the harder it is for the bully to get done what they want to get done. And that's just what history tells us. There's no judgment in that. That is a fact. And so we've seen it over and over again. And we saw it recently, we see it, and it was just, how long is World War II? We're all still living. There are many of us here who lived during that time. So it's not like it's ancient history. Trying to stay below the radar of a bully. And look, we have a gay governor, right? We have an Asian mayor who's a sanctuary city. We have a black attorney general. We have Harvard. These are all the things that this president doesn't like. How long can you stay under the radar? So I know this is going to go out and people are, going to say she's recommending that, revolution. But, You said that, not me. But I mean, I'm just sort of repeating what I learned through history, not, you stand up, and you pay now or you pay a whole lot more later.
I have a quick question. What options or role does the state have in terms of the ICE detention facility in Burlington? I did notice a handful of ministers were recently arrested for trying to provide aid to folks in that facility, and also that our state representative has not come down to tour the facility.
Your state representative is not allowed in, because it's a federal facility, and I'm pretty sure it's on private land.
Markey was there.
But Markey is federal.
He came to Burlington.
He came and he went through, yeah, but like, I can't go in, Rep. Socolo can't go in. So that's what, and so we don't have any, we have no control over that. It's federal, and that is part of the problem.
Can you give me the name of the company that this facility has been rented from? I believe that it's a private company
Yeah.
that we all know. And where is it exactly? We want all this information because a lot of this is
Rita
talked
has it
about.
in her phone somewhere. I
A
don't
lot
have
of
it.
these things get talked
It's under
about
the No
as
Kings,
issues,
the
but
No
we don't
Kings
get
people.
given enough details to be able to
Microphone,
even know.
Gmail.
We need details. If anybody has it, I'd love to have the details.
Yes, we will, yes, we can get that to you.
Thank you.
Just because the Burlington.
I'll get you next.
Well, that's good.
Good morning. Hi, good morning, Senator Friedman. Thank you so much for coming to Lexington to speak to us, and thank you for your leadership. I want to talk about affordability. As we know, people everywhere are struggling to pay their bills, whether it's for food, whether it's for Medicaid, whether it's for health insurance premiums, as you mentioned, and housing costs. I know that recently the House passed a version of a bill to address residential property tax spikes. And the Senate has also passed their own version, which seems more aligned with Mayor Wu's version of affordability. So I'm just wondering, how would those two bills be reconciled? What do you see the path forward on this? And just for the benefit of the audience, what relief are these bills trying to seek to help our seniors and low income?
The Senate, I can talk about the Senate bill. So what the Senate bill is doing is, so part of the issue is that the mayor of Boston wanted to change the rate of residential tax to commercial tax. And she wanted to increase the commercial tax rate and lower the residential rate. And this caused people a lot of concern. One of the issues is that the commercial base of Boston, which is one of, if not the largest economic engine, has really suffered. And it's not just the big corporate, it's a lot of the small businesses that feed the commercial economic engine of that, So there was a lot of concern that that was gonna cause more damage, right? And so what the Senate did was pass a number of bills that would allow for tax relief at the local level for people who, low income, elderly, and people that the people that you were talking about. So that's the difference between the two, and the Senate version is statewide and allows local communities to enact this. In fact, I've been working on something with one of your wonderful constituents who just passed away, Pat Costello, which The first time we did it is it reduced the so you can defer your property tax until you sell your property. And at the time, the rate was 16%, and we brought that down. And then now it's extended for a year so that you have time to settle to settle the estate. So it's a start, but I believe that what we need to do is give cities and towns more ability to raise their own revenue. Because if they can't do that, then they're really dependent on local aid and property taxes, and that's not going to bring down and make it more affordable. The other piece of it is that there's the tax, the transfer tax, when a property is sold, and that's something that's been before us, and I think it makes a lot of sense, right? And it's for properties over a certain amount of money, and but it gives money to the towns to invest into affordable housing. And then the other pieces that are around the housing is we have to build more. And whether we like it or not, we have to build more. And we have to allow for people to build more in a way that they can afford. So ADUs are a great thing. I mean, I think that, the law that said you can build an ADU, well, we put so many restrictions in place that it makes it really, really expensive to do that. And so, if we want to bring down the costs of housing, which to me is the most important thing that we can do right now, because that's what people, you need three things in your life. You need a roof over your head, you need food on your table, and you need to be able to get taken care of when you're sick, or not prevent you from getting sick. The rest of it, while I care deeply about all of it, if you don't have food and housing, it's a non-starter. So to me, the purpose of the government is to ensure that those fundamentals are covered. And I think that if we're going to do that, we have to focus on all of the things that are going to bring that down. Now, we can't salary our way out of this, right? We can't say, well, just pay people more. Pay our personal care attendants, pay them more. Well, in order to live in Lexington, they have to make about $75 an hour. And even then, they could only rent. Well, we can't salary our way out of that. So we have to figure out a way to bring down the cost. And the way to do that is to take some of the money that lots and lots of people, like the real estate, in the real estate place where people are, where there's lots of, what am I thinking? What's the word? I'm sorry, have you seen a moment? When you look at what you get, what's the word?
Appreciation?
Not the appreciation, it's your profit, yes. Right, thank you. Should we have a real estate transfer tax? I believe we should, right? Should we take some of that money and invest it in affordable housing? I believe we should. Should we do some kind of ensure that people can stay in their homes if they don't have other places to go? Because that's the problem, right? I can't leave my house because I can't afford anything else. Should we start building more places where people can go that are nice and that are community based and that have, and that are affordable? Yes. Does that mean there's going to be some more houses being built and things will look a little different, things will change? Yes. But if we're serious about it, that's the kind of stuff that we have to do. Now, on the other sides of food, and we need to fund every single food program out there, and we need to do it to the extent that it needs to support people. Nobody should go without food. There's too much food in this state, and we should make sure that all of those places that support food and security are well funded and have an efficient way of getting food out to people. Our schools, turns out what we learned in COVID, our schools feed kids. Weird, Doesn't make me happy, but it's true. Let's make sure that food gets to our kids, and anything we need to do to fund that, we need to fund. Now, healthcare is the other piece of it, and we have now started an affordability task force that the governor has put together, where we're gonna look at all the aspects of healthcare and see where we can take some of the dollars out of the system so that it becomes more affordable. But I have to tell you, in order to do that, pharmaceutical companies have to be at the table, pharmacy benefit managers have to be at the table, insurers have to be in the table, hospitals, providers, everyone has to be at the table, and we have to make sure that they give some skin in the game. So what happens in solving these problems is we say, okay, we want to make it more affordable, right? And we're going to go to pharmaceuticals. Let's lower your prices. And they go, oh, well, we can't do that because, it's really expensive. And we say, well, we want to make, we might leave Massachusetts, right? We're the economic engine of the state. So let's make sure that we don't, you don't do anything to us because we're giving you all this money. Well, every one of those entities will tell you the same thing of why they can't give you anything. So it takes a lot of will and a lot of leadership to say, we get it, we hear you, but you gotta give something. And unless we do that, and unless we are demanded to do that, I think it's gonna be really hard. That's what we need to bring those prices down, right? And we can't keep going after the lowest paid people to do it, the community health centers, right? We can't take money from the community health centers because they take care of all, 90% of the low-income people in the Commonwealth. So let's not hit them, right? But I love MGB. I love MGB. They're the highest cost system in the state by far. So can you help us a little? Can you give us a little more? So anyway.
A couple of things. Okay, we have her and Tom, but did you get that contact?
Yes, and you could read it out if you,
Okay.
because
I'll
I'm not
read it
supposed
out.
to be speaking, you're supposed to be speaking, but this
Always
it's
happy to
this
have you.
paragraph about
It's ready.
Rutherford, and then there's a little
Okay.
bit about how the mall is also cooperating and making it hard to get to Burlington.
Okay, and I have some word on that. Okay. Robert Murray, owner of the building where ICE pays him $2.2 million per year, largest commercial landlords in Burlington and Woburn. So it's Robert Murray,
Thank you.
I keep writing down because
M-U-R-R-A-Y.
the
Now,
mall itself is cooperating too.
Now, I have some information on whether the mall is cooperating. The mall actually is not cooperating. What the mall is responding to is a group of people that have come into the mall and have,
Demonstrated, disrupted.
there is a story behind that, and they were not stopping people from parking there, they were not. I think what happened is around Christmas time, the mall asked, could you please, for certain days, not park here because this is our season and we need, and they took offense to that, came into the mall and, had a protest, sent out all this information about what the mall was doing and not doing. And it caused this thing, okay, fine, and you can't come in. You can't, fine, and you can't park here. And so I had heard the same thing. I heard Macy's wasn't allowing their parking lot. I'm like, I'm not gonna go to Macy's anymore. And then I talked to some people and they said, well, actually, that's not what happened. And we have to, we have to be careful about what we do. We need the parking of the mall. If they ask us to not do something for a day, maybe we should listen to that because it seems to be a fair, Anyway, so before you say that, I saw that article, but I'm not sure it's true.
Thank you for clarifying that. I think we've got a lot of good information today. Thank you, Rita. Thank you. So this will be the last question. It's after 10:30, so you're.
Hi, Senator Friedman.
Hi.
You just touched on this a bit. What do you think of the abundance agenda, the idea that we need to make it easier to build things like housing and energy infrastructure? And more broadly, do you think this is a strong message that Democrats nationwide can run on? And lastly, do you think the Democratic base itself is willing to give up some control in order to realize the abundance agenda? Thanks.
Well, my experiencing is people are willing to give up a lot as long as it's not actually them that has to give up. I mean, that's human nature, man. Like, you know, it's like, I think it's like Arlington is gonna have somewhere around a $14 million override. And with all my information and all the stuff I know, I'm like, "Ew, that's a lot of money. That's $1,000 average is that, do I, and I know a lot, right? And it's all to fund all the things I care about, right? I will support the override. But I think Democrats have to run on what matters in that community. I think the problem with Democrats has been that we know what should happen and we believe in certain things, we care about certain things, and those are the things that we're going to go out and tell you about. And it turns out, I don't care about that. Talk to me about something I care about, right? So unless Democrats get a whole lot better at talking to people at the levels, at the local levels, at the communities that they're going into level, they're always going to lose because I don't care about what does abundance mean to me, right? I mean, I understand what it means and I care, I think it's great. But if you can't translate that into me as a person sitting in the middle of Iowa, it's gonna just go whoop. And here's another Democrat coming in and telling me, what's wrong and they're elite and they know. And it's like, if I talk to you differently than the way I talk to other people in my district because you care about stuff that's different than what they care about. So if I start talking to them the way I talk to you, they're going to turn off because they don't care about that. And so that's what we have to get better at, and that's hard work. And you have to then allow that people who win under those circumstances that they're now at the table, and maybe they have to represent things a little differently than the whole Democratic agenda. And that's what happens at the State House, right? We have all these colleagues, there's 35 of them are Democrats, and they're all different. And I have Democratic colleagues that are worried about doing anything about ICE or worried about doing something where the local law enforcement can no longer, most of them don't, but they can't engage with ICE. They don't want to touch that because they're from very conservative districts and their conservative folks see this as, ICE is law enforcement and we support law enforcement. So you have to figure out how to, if you're going to say, okay, I'm going to talk to you about what you care about, and then you win on that, and it is a democratic principle, but then you come with a whole bunch of other stuff that may not be what I would believe in, we all got to deal with that. And that's what government's supposed to do, because as much as I know I'm right, there's a whole bunch of people out there who wouldn't agree. So that's how you have to build coalitions, and why it's consensus, and why people hate it, right? They want you to just do something, do it. And it's like, well, yeah, I want to do it and you want me to do it, but 39 of my colleagues don't want to do it. So so it's called government, right? It's called sausage making. So that, I don't know if that answers your question, but that's sort of what I believe. If you can take that abundance agenda and break it down, don't call it abundance agenda, don't call it, because people are like, and you can break it down into pieces that individual people can understand and that affects them, then I think it can go far.
Thank you, Senator. We're gonna call it into this meeting because it's now 10:40. I thank you so much for coming and spending time with us today. We covered a lot of topics, and we'll invite you back again sometime, but not next month. Because next month, we're going to have Kelly Beatty from Lincoln, who's gonna talk about the dark side of light pollution. It'll be be upstairs on March 6th, so stay tuned. We'll be sending out announcements about that. And with that, I think we should give Senator a round of applause.